How do we talk to and with each other? How do we maybe do less telling? Because communication isn't just about sharing information, it's a two-way street. How do we ask more questions?
Welcome to Connect Live at Adventist Health, and a Happy New Year to all of you. I'm Joyce Newmyer, the Chief Culture Officer at Adventist Health, and your host for Connect Live. Live this week, together, new year, new day, hope in 2022, and Kate, a trusted partner. Together, a new year, a new day. 2022 belongs to us. It's our year. It's our chance to be kind to everyone. We can take our ordinary days and expect wonderful things because we're wonderful people engaged in making others' lives wonderful. On January 1 this year, Adventist Health released Together, New Year, New Day, a message from Carrie Heinrich, our brand new Chief Executive Officer for Adventist Health. It's online for you to watch, and together, choose hope. Visit adventisthealth.org/story and look forward together. New year, new day. Hope in 2022. Last year, when we ended season 1 of Connect Live, we shared that Carrie Heinrich, our new CEO, was going to join us for the first Connect Live in 2022. That was the plan. But travel all over the country has been massively disrupted. And as a result, Carrie will be with us next week. Today, I'm delighted to welcome back Bryan, Chief Mission Officer for Adventist Health. Thanks for joining me at last minute, Alex.
Hey, there's nothing like being the substitute teacher, so I assume that I'll be treated really well.
I knew you were going to say something about being the substitute. It's never a second best to have Bryan on the show, so welcome to you. And Alex, you and I have been talking a lot about how deeply concerned we are for our frontline caregivers, those who have been through so much over the past 2 years. It's hard to believe we're actually about to enter year 3 of this pandemic, and we're concerned for people's not just resilience but perseverance. Tell me more about what your perspective on what you and I have been talking about.
Yeah, and I appreciate you mentioning it, Joyce, to all those that are watching and listening, that you and I have been text messaging, calling, really worrying over the emotional health, the spiritual health, kind of the resiliency of our absolutely incredible physicians, nurses, and all of our clinical teams on the front line. I think one we've been talking about, and I think this is important to acknowledge because maybe those of you who are leaders who are leaning in, first is that we don't have all the answers. That I think that it's important for us, Joyce, sometimes just to acknowledge the condition that this is really a challenge. We're in unprecedented times in many respects. And you and I were sharing a newspaper article that came out yesterday that was talking about some 75% of healthcare providers that are really at dangerous levels of stress and burnout, depression, despondency. And so I think that's first, just acknowledging the size of the problem. Yeah.
It's a big problem. I was talking yesterday with one of the Adventist Health Hospital presidents, and I said, as a chief culture officer trying to figure out how do you support culture in the middle of a pandemic where people are so disconnected from one another, I'm so frustrated. And I said, help me know what you need. How can I help you? And the answer was, I don't even know what to ask for at this point. Our people are exhausted, they're stressed, and it's like, Joyce, you don't have a license to come and take an assignment of patients. I don't even know what to ask you for right now because no one has time or attention to put into anything other than just taking care of our communities. So Alex, I don't know, as Chief Mission Officer, how do we help And I know it's almost like a rhetorical question
right?
because we're trying to figure this out on the fly.
I think there's a couple things that strike me early, and one, tapping into something Jesus did in Luke chapter 2. He sent his essentially healthcare workers. He sent his ministry teams out 2 by 2. So the first thing I think to keep in mind is that compassion means that we will suffer together. Com is community. Um, we will do this thing together. So I think first of all, just acknowledging how much we need each other. And you talked about kindness in your opening remarks, and I think that's exactly right. I think we need loads of kindness. I think we need to support one another. We talk about that all the time, but I think that's really key. And in addition to that, I think that it's important to acknowledge and to remind each other about the honorability of the profession that particularly our frontline caregivers have entered into. The article you and I read talked about some of the stress that's coming as physicians and nurses and others are saying, we're just not respected anymore. We're serving a population that's not working with us to deal with this great challenge. And I think it's really important, particularly I want to say to leaders who are here, but to all of us, we need to remind each other about the nobility of the work we've committed ourselves to. It's honorable work, it's beautiful work, and even though it's difficult, this is historic stuff, and we will look back at these times, Joyce, I think, and be able to acknowledge just what remarkable labor was given in the service of love.
I agree. I'm blown away by the bravery and the determination that we see from all of you, the people who are taking care of patients, the people who are showing up to the hospital every single day, not knowing who's going to come through the emergency department and what are their needs going to be, the clinics where you never really know who's coming through the door. I'm just blown away by the bravery and the determination. And I know, Alex, you and I have talked a lot about this, how we want to help and we don't want to be in the way. It feels like showing up at a hospital and saying, I'm here to help. It's almost like you become something more for people to do and to pay attention to. And yet I think I can speak on behalf of all the cabinet that any of us will show up and do whatever you need us to do. We just don't understand what that is. And so to the caregivers, we see you and we want to help you. We're not always sure what that looks like.
Yeah, that's exactly right. And I think that a discipline that our team, Joyce, is talking about is before every single meeting that we engage in, every piece of work, the first question needs to be, have we put on our glasses, our lenses that say we are going to think about these problems through the way that physicians and nurses and other frontline caregivers are going to experience this. Every dollar, every strategic move, every ask, we need to begin with those people in mind. And so I think that's an important commitment. But this is about dialogue. I think this is about community. This is about all of us kind of knowing we don't have the answers, but together we're going to push through it.
I think 2022 needs to be the year of that increased dialogue with real conversation about what people taking care of patients need and how we can help. I don't have a license. I can't show up and take a patient assignment, but I can do other things. And all of us need to figure out, how do we support the people who are supporting the communities and caring for them, right?
I think that's exactly right. And I know that we have a lot of viewers, listeners that are even outside Adventist Health. And I would just say to every church, to every synagogue, to every business, to every government person, we all need to rally around our healthcare providers in this country and around the world. This is an incredible gift that we have in them, and they should not be taken for granted. I think we're in a moment where we're putting them at risk, not only the disease, but in sometimes our behaviors. And so I think that we need to be praying for Joyce. I think we need to be supporting. I think as a society, we need to understand just how fragile and how precious the gift of modern healthcare is in this country and other places around the world. So I just want to urge us, we all need to step up, not only those of us who wear a badge that says we work for a healthcare company.
Well said. Thank you, Alex. Thanks for being with me here, kind of last minute due to some travel interruptions, but always valuable conversation. I appreciate you being here with us.
Thank you.
Our final story today is superhuman. Triage nurses have one of the highest rates of burnout. But at Adventist Health hospitals, they have extra expertise at their side that you could say is superhuman. The machine learning powered tool called Kate is helping care for patients who come to the emergency department and ensure that they're getting the very best care they can receive, whether there are 100 people to see or just a few. While we think that our nurses are superhuman, we've been talking about that. We're so excited to provide a tool to help. So you can discover more about Kate and how it's used at Adventist Health White Memorial and many other stories at adventisthealth.org/story. You can discover this story and many others at that location. Friends, thank you for connecting live today, and we'll see you here again next week, again when Carrie Heinrich, our new CEO, will be with us. Until then, let's all be a force for good.